Good afternoon, ladies and gentlemen. Today I will be presenting on non-invasive therapy in cardiology, extracorporeal cardiac shockwave therapy, or CSWT. We will explore how this innovative non-invasive technique is awakening ischemic heart failure muscle, offering new hope to people, especially patients with refractory angina and microvascular dysfunction. This presentation will review its mechanism, the robust clinical evidence supported, and its practical application in 2026. Contents. I will introduce it from 1, 2, 3, 4, 5, five key parts. First, we'll set the stage by examining the unmet needs in modern cardiology, particularly for patients with refractory angina. Then, we'll dive into the technology of CSWT, understanding how physical energy translates into biological healing. Next, we'll cover the practical aspects of clinical application. Following that, we will review the compelling clinical evidence for its efficacy. Finally, we will summarize the current state of CSWT and look towards its future potential. One, introduction. The unmet needs in modern cardiology. Despite decades of progress in cardiovascular care, many of patients still face challenges with residual symptoms and disease progression, highlighting clear needs for innovation. In China, according to the summary of the China Cardiovascular Heart and Disease Report 2024, the incidence rate and mortality rate of cardiovascular diseases continue to rise, and the turning point for cardiovascular disease treatment had not yet appeared. Introduction. The unmet needs in modern cardiology. First, the burden of CAD. CAD remains the leading cause of death worldwide, presenting a significant global health challenge with profound socioeconomic impacts. Limitations of current therapy, PCI, CBG, but a large subset of patients still suffers from residual ischemia and refractory angina with limited therapeutic options. The need for new strategy. In this reason, a safe, non-invasive, and effective therapies that can target the microcirculation and stimulate the heart's intrinsic capacity for repair. The burden of CAD. Global health challenge. CAD remains the leading cause of death worldwide, despite advances in treatment. The prevalence of stable CAD and heart failure is rising due to aging populations and comorbidities like diabetes or chronic condition. CAD is a progressive disease requiring lifelong management. By 2030, it is estimated that nearly 23.6 million people will die annually from cardiovascular disease. The armamentarium of the treatment. 1. Pharmacological therapy, GCI, CBG, chronic management, lifestyle modifications, cardiac rehabilitation, and long-term medical follow-up are essential components of care. These are very important. The limits of current therapies, it is new challenging. Residual ischemia, refractory angina, coronary CMD, instant restenosis, graft failure. The need for new therapeutic strategy. Unmet clinical needs. There's the critical need for safe, effective, and non-invasive therapies targeting microcirculation and promoting myocardial repair. Current limitations in treating microvascular dysfunction and stimulating intrinsic cardiac healing mechanisms leave many patients undeserved. Paradigm shift. The focus is shifting from treating obstructive lesion to improving overall myocardial perfusion and stimulating intrinsic healing mechanisms. The third, introducing CSWT. Part 2. CSWT technology, how physics awaken the heart. The first, what is CSWT? It is the non-invasive technique delivering focused acoustic shock waves to ischemic myocardial mechanism of action. Shock waves induce mechanical stress, triggering a biological cascade. Key biological effects: stimulating angiogenesis, reduces inflammation, and improves endothelial function. Evidence-based. Preclinical and imaging studies consistently support the therapeutic mechanism of CSWT. What is extracorporeal cardiac shock wave therapy? Definition and technology, how it works, key parameters. Mechanism of action. The biological effects of CSWT. Promoting angiogenesis, inhibiting apoptosis, suppressing inflammation, modulating oxidative stress. These are key pathways. Promotion of angiogenesis. CSWT acts like a fertilizer for blood vessels, stimulating the release of growth factors and recreating stem cells to build new capillaries, effectively creating a natural bypass around blocked arteries. Attention of local inflammation. By reducing pro-inflammatory chemicals and switching immune cells into a repair mode, it creates a healing environment in the heart. addressing the root cause of tissue damage and promoting long-term recovery. Part 3. Evidence supporting the mechanism are not just theoretical. They are backed by solid scientific evidence across multiple research domains. Preclinical studies, imaging evidence, JCC, molecular studies, European Heart Journal. Clinical application, the practical guide, indications, identifying the right patients who will benefit most from CSWT. Heart failure, New York heart failure. 1, 2, 3. And those unsuitable for revascularization. Conditions, treatment protocol. Indications, contraindications. Indications 1, 2, 3, 4. Contraindications, absolute contraindications, relative contraindications. Chinese expert considers as a CSWT for CHD. The CSWT treatment protocol. 1. Treatment course. 2. Target selection. Based on the 17 segment model of the left ventricle, select from 1 to segments with the most severe ischemia. Energy and dosage. 3. Step-by-step treatment procedure. Procedure overview. The treatment is safe, non-invasive and precise 4-step process guided by echocardiography. It is synchronized with the patient's heartbeat to ensure maximum safety and efficacy. Preparation phase, treatment and execution. Safety profile of CSWT. Excellent safety record. Well tolerated. Clinical safety findings. Mild transient side effects. No reported major complications. Clinical efficacy. The data speaks. CSWT delivers measurable benefits across symptoms, physical capacity, and overall patient well-being, angina reduction, exercise tolerance, quality of life. Overview of clinical trial evidence. Numerous clinical trials, over 20 randomized controlled trials, and several meta-analyses have been conducted to rigorously evaluate the efficacy and safety of CSWT in patients with ischemic heart disease. Consistent findings, key trials. Key evidence, reviewable, and recent waves 2 in 2024 have provided high quality, robust clinical data. Improvement in exercise tolerance. Increase time to segment depression. Increase the total exercise duration. Mean increase in exercise time. Enhance the quality of life. Improve the score. SF 36. Physical limitation. reduce the limitations in daily activities due to angina. Angina stability frequency, less frequent and more predictable angina episodes. Treatment satisfaction, high satisfaction with the non-invasive nature and results of CSWT. Objective evidence of improved perfusion. SPGCT, CMI, 15% reduction in hyperfusion. 2024 study utilizing CMI technology qualified 15% reduction in the total extent of hyperperfused heart muscle tissue, measured just 6 months after CSWT treatment. Cardiovascular magazine racing data source. Cardiovascular magazine racing. Long-term outcomes. The beneficial effects of CSWT appears to be long-lasting, with improvements maintained for at least from 12 to 24 months in clinical studies. The core advantages, sustained benefits. CSWT can sustain improvements in quality of life and effectively reverse cardiac remodeling, providing long-term benefits for chronic heart failure patients. Repeatability. Repeatment with CSWT is feasible and many provide additional benefit in patients for experienced symptom recurrence. Part 5. Summary. Future. It is a new horizon. A valuable non-invasive tool. Mechanism. Clinical benefits. It consistently improves the angina symptoms, exercise capacity, and quality of life. Current operation is a class 2B recommendation in the 2023 ESC guidelines for chronic coronary syndrome. Conclusion: weakening the heart. A powerful non-invasive therapy. Strong evidence base. The journey continues. Thank you for your attention. Thank you.